Okay, you guys, well, I am here with Dr. Lori Stetler, who is my dermatologist at the Dallas Center for Dermatology and Aesthetics. And so Alex just designed a skincare routine for me and a regimen. And so Dr. Stetler is going to kind of go over it with me. And I'll tell you what I really want to know for everybody is what are the key skincare regimen types of products that women over 50 need in general.
Got it. And I always tell people 3 main anti-aging ingredients that you want to consider. Number 1, which is actually number 4, but the most important is sunscreen. So if you do nothing else, sunscreen becomes number 1. And honestly, if you're working on anti-aging and you're not doing sunscreen, you're doing yourself a big disservice. So that's number 1. And then we kind of categorize into buckets. So you've got antioxidants, which are things that contain vitamin C, vitamin E. The one that Alex recommended was this serum that's called C. ferulic.
Okay.
These are collagen builders, internal sunscreens, if you think of that. And these are usually done in the morning. The next is, this is a retinol, and there is a broader category called retinoids, right? So prescription retin-A, retinol, some of the things over the counter. Those are generally used at night. It's probably the longest anti-aging ingredient that we've studied since like the 1970s. So there's a lot known about what it does for the skin. So great for exfoliating dead skin, great for normalizing cell turnover to prevent precancers, collagen building at a deep level, evening out pigmentation. So lots and lots of benefits. It's the most irritating potentially, so depending on the skin type, we may or may not choose that, but we use this a lot, and patients who use it for years look amazing. And those again are done at nighttime. Then the next group is a kind of a broader group called growth factors. And those, as we age and the growth factors decline in the skin, anything we can do to boost the levels in the skin helps us. So what we want to do is build collagen, right? And so we've got some different products here. This is one of our favorites. This is kind of a combo product where it's got antioxidants and growth factors. But again, good for collagen building, evening out skin pigmentation, building collagen. Very non-irritating. So if you've got somebody with more sensitive skin, rosacea, super dry skin, these do great. So if you have somebody who can't tolerate retinoids, sometimes we'll just do growth factors. And sometimes people who want to do everything will kind of make a combination that works for you. And then we've also got some good eye creams that have growth factors in them as well. So I know it's overwhelming, and we will kind of sort it out when we do our live show. But yeah, and I think the key for us is, I think as dermatologists, we're the experts in skincare, and there's not one skincare line necessarily that works for each patient. So we like to cherry pick kind of based on, everybody's individual skin type.
Yes, so again, the moral of the story that I'm hearing you say is that it's very individualized.
Absolutely.
And that people really need to visit a dermatologist, an esthetician, to get a regimen that works for them specifically. So this is the one you've designed for me. I'm going to be sharing it on emptynestblessed.com and telling you why each of these products was recommended for my particular concerns. So thank you for your time.
Okay.
Thank you, and be sure to tune in for our Instagram Live.
Okay,
It's gonna
see
be
you
great.
soon. Yeah.